This video will present the mechanism of action of Benlysta. Benlysta, a Bliss-specific inhibitor, is the first and only FDA-approved biologic therapy developed to reduce systemic lupus erythematosus, or SLE disease activity. The role of B cells in SLE. While many factors are thought to contribute to the immune system abnormalities in SLE, Benlysta targets B lymphocyte stimulator, or Bliss, which prolongs the survival of B cells, including autoreactive B cells. Let's look at this in more detail. In the normal regulation of B cell populations, pre-B cells and immature B cells are cleared from the body at key checkpoints in the developmental process, beginning in the bone marrow, where they undergo apoptosis, or programmed cell death. Apoptosis is important to the maintenance of a healthy immune system. It is a normally occurring process that removes some B cells from circulation, preventing an overabundance of abnormal antibody-producing B cells. During a normal immune response to foreign antigens such as bacteria, more B cells are allowed to survive, proliferate, differentiate, and become plasma cells that produce antibodies to fight the infection. A cytokine known as Bliss plays a pivotal role in the survival of B cells by preventing normally occurring apoptosis. The role of Bliss in SLE. In many patients with SLE, higher concentrations of Bliss promote increased B cell survival, including the survival of autoreactive B cells. Bliss binds to multiple receptors on the surface of a B cell. Bliss-mediated receptor signaling promotes the survival of autoreactive B cells, otherwise destined for apoptosis. These autoreactive B cells remain unchecked and circulate in the body to become mature autoantibody-producing plasma cells. Benlysta, a Bliss-specific inhibitor. Benlysta is a targeted human monoclonal antibody that specifically binds to soluble Bliss and thereby inhibits the binding of Bliss to B cell receptors. This allows more B cells to undergo the normally occurring process of apoptosis, which inhibits the survival of B cells, including autoreactive B cells, and reduces differentiation of B cells into immunoglobulin-producing plasma cells. Benlysta does not bind B cells directly and does not directly deplete B cell populations. In summary, Benlysta is the first in a drug class known as Bliss-specific inhibitors. Bliss plays a pivotal role in B cell survival and B cell proliferation by preventing normally occurring apoptosis. Benlysta specifically inhibits soluble Bliss. Benlysta does not directly bind to B cells and does not directly deplete B cell populations. The indication and important safety information for Benlysta are presented at the beginning of this video.